Hi, future nurses. This is Dr. Nye, your DNP nurse educator and mentor. Today, I want to teach you about how to show up with confidence for your first day of clinicals. I want you to know when I showed up for clinicals, no one taught me anything about confidence, but I assure you, this is something you're going to need in the future. So let's start early working on clinical confidence. I'm going to give you 3 tips that's going to guide you through this process. Tip number 1, you are not an imposter, meaning that you're not a nurse yet. So let's accept the fact that you are a student and you are showing up as a student to learn. Give yourself grace. This is your grace period to learn as much as you can. Tip number 2, a little preparation is major power. You know you're starting clinicals. I need you to prepare. Show up to clinicals early. Get your assignment, review the chart so that you'll have an idea of what type of patient that you're going to be working with. The night before, I need you to prepare. Look up some common medications that might be given on a med-surg unit and become familiar with the type of medication so that when you are getting ready to give medication, you have seen it, you have heard it, you know the side effects. Preparation is key. Also, practice taking vital signs. Practice on your family members, practice on your friends. I know when I was starting out as a new nurse, I practiced taking vital signs on anyone I could. So start early. Also, I need you to prepare on how to give an SBAR. If you're not familiar with giving an SBAR, look these things up so that when you show up to clinicals, that you're not just standing there like, I don't know. Take the initiative to look up some of these things so that you are prepared. Okay? The third thing is stop apologizing. I want you to show up to clinicals knowing how to ask questions. Don't be afraid to ask questions. As nurses, this is something that we must do to collect data so that we can provide the appropriate care for our patients. So an example of asking a right question is showing up to a provider and simply saying, can I ask you a question about Mr. Knight regarding a particular situation? Do not apologize. You need to become confident in asking questions because this is what nurses do. You need to make sure that you're being safe and teachable. Asking questions shows that you are teachable and you are willing to learn. So, let's recap. Tip number 1, this is what I want you to do. You're not an imposter, you're a student, you're there to learn. Tip number 2, preparation. Tip number 3, stop apologizing. Ask the right questions. Lastly, you've earned this spot. You have prepared, you've passed all your pre-courses, you've earned a spot in clinical. So show up like you're ready to learn. If you want to learn more about being clinical confident, continue to follow me, subscribe to my channel, and I will continue to be your mentor and educator. Thank you. Lastly, do not show up to clinical with these big hoops. I just want you to know that nursing is a profession and I am a 30-year experienced nurse and I love to bedazzle myself outside of clinicals, but when I do show up in clinicals, I show up professional, I pin my hair up, and I wear shorter, smaller earrings, okay? So don't let this picture fool you. Good luck in your first clinicals.